Can everybody hear me? Yes, you can. I'm loud. I'm from New York, and forgive me if I get too too loud. But I'm here today, and by the way, I wanted to just say thank you so much for Bernice for bringing that to life. It's so important for us to see, what it looks like in the clinic, erosive tooth wear, and those cases that she showed us were mild to moderate and even more advanced. But I'd also wanted to just bring it back to Dr. Hara to say thank you, Dr. Hara, for talking about the prevalence and early detection and how important that is. So, as you can see, I am not John Preeth, but I am one of John's colleagues, and I am here to talk to you today about the role of fluoride toothpaste and how we can use a specific toothpaste that we've developed to help protect against erosive tooth wear. So, his disclosure is almost similar to mine. We both are employees at Haleon, and the clinical studies that we will be discussing today and presented in this presentation were sponsored by GSK Consumer Healthcare, which is now Haleon, and they were performed by the Oral Health Research Institute of Indiana University. So a lot of our research comes through there. What I'd like to bring back today is just to talk to you a little bit about an optimized formulation that we've created. And so I have three key messages that I'd like to get across and bring out first. And the first one is the role of fluoride as a protector against erosive tooth wear. Second is the importance of the formulation for the fluoride's performance, something that we don't often think about, but I'm going to show you that's extremely important. And of course, the evidence that supports the new optimized fluoride toothpaste that we have, Enamel Active Shield. And so when we think about erosive tooth wear and we try to understand how it happens, we want to look at it, we like to look at it as a box, as a pivotal box. And so when what we need to understand is a lot of there's three different types of challenges that happen to our tooth surface that can make an impact in what we do. So the first one is always our dietary challenges, right? The scientists have understood that more than 4 to 5 dietary exposures to acid bring on an acid challenge. So that's something that we should always consider, as well as the physical challenges that come along with that. So when we think of the acid challenge, it's just important to understand that that acid challenge is what gives us the enamel a little softening, right? So we start with that softening of enamel, but then we throw into the softening of enamel the complexity of the physical challenges, right? So we have the physical challenges can be attrition, it can be tooth to tooth, right? Like a abrasive, attrition, abrasion, abfraction, or it could be, brushing, really aggressive brushing, right? Toothbrush abrasion, or a combination of aggressive brushing and a highly abrasive toothpaste. And so even some people have off in their tongue could cause a physical challenge, which is the constant rubbing along the tooth surfaces. And so it will make little indentations or divots that Bernice kind of mentioned and she, talks to her patients about. But then when we think about these three different factors, we have to understand in this box as well that we also have some protective factors, right? And so when we talk about what those protective factors are, we look at the pellicle. And so we know that in the saliva, we have a pellicle that binds with the saliva and attaches itself to the tooth. And it kind of forms that protective layer on top of the tooth surface, right? And then we also have to consider in that saliva again, but take that saliva one step further to say, okay, we have the pellicle that's protective, it's a coating on the tooth surface, but then that saliva, we know, decreases the pH and can wash away some of the acid. And so we need to consider that as a protective factor, as well as some of the tooth structure. Larger teeth, larger enamel is going to be, less destructive, as well as the fluoride, right? And so when we look at this box, we like to try to consider, what is the risk factors involved, right? What does that look like, and how do we minimize these risk factors? And so this is what we understand. If someone's having acid challenges for more frequently, if they are sustaining physical challenges like attrition, toothbrush erosion, and so on. That's a constant wearing away of the enamel surface. And then if we have low protective factors like a low salivary flow, or we don't have a lot of a salivary pellicle on our teeth, or we're not really getting enough fluoride into our diet, we begin to understand how this erosive tooth wear is beginning to break down. And so if we looked at this box and we look at what the challenges are, the only one that we can really change, and the one that we like to modify the most easily for our patients, is the fluoride, right? We can always say, hey, we can use fluoride to kind of give us some of that protective factors. And so you must be thinking right now, I'm going to take you back a little bit for those of you that are, in dentists or dental hygienists, like, how does fluoride toothpaste, protect enamel? And so when we look at the complex crystal lattice that is hydroxyapatite, when we mix the fluoride with it takes the place of the hydroxide ions, and it makes the tooth stronger, right? So as we kind of go back to understanding, the tooth is gonna, when the tooth is stronger and the tooth becomes more fluoridated, that the tooth is stronger, more stable, and more acid resistant. And so we get that having that crystal lattice becomes much tighter, and it goes from that hydroxyapatite to that fluorohydroxyapatite, which you're most familiar with. So when we have that input, or we have that change of that fluoride level that's increasing, we say that that's a remineralization process. And that remineralization process will protect us. It'll make the tooth stronger. And so when it makes the tooth stronger, it also helps in demineralization, because that demineralization comes from the dissolution or the dissolving of the enamel layer. And so this will help prevent that. And that's what fluoride does. So what exactly does fluoride look like? So what you have in front of you is a dynamic secondary ion mass spectrometry image, which is also known as DSIMS. And when you look at that image on the left and you look at the sodium fluoride product that we have, you can see that there's really that clear pink bar, that protective shield across the top that we're getting from this formulation. You can see the new calcium uptake in that image. And what you're seeing next to it is when you're not getting that, right? So it's something that's completely opposite. And so the reason why we like to talk about toothpaste formulations is because, believe it or not, what's inside that toothpaste can inhibit the binding of the fluoride. And so it's really important to understand what the ingredients are, because we have taken out some of the ingredients that might interfere with fluoride in our product. And so the first ingredients that we've taken out are the calcium ingredients and some of the abrasive materials that are impure. And so those are the ones that gave us some direct binding. And so we no longer have them in this product. And then we'll also take out the SLS, and we take out the polyphosphates. And those are the polyphosphates from any of the whitening toothpaste. We take out the SLS, we take out the polyphosphates, because we find that they directly bind to the enamel surface. And when they bind with the enamel surface, they're interfering with the fluoride uptake in the tooth. And so the last thing that we did is we're taking out the polyphosphates in this material, in this toothpaste. But in this toothpaste specifically, we've found that a lot of zinc and a lot of stannous products interfere with remineralization. And so we've taken all those out, and what we've done is a two-stage approach. And so in our two-stage approach, we've taken out those ingredients. So we've taken out the SLS, we've taken out the polyphosphates, and we've taken out those polyvalent metal ions. And so that's just an image of what it does to block the fluoride from attaching to the tooth surface. But in stage two, what we've found through all the studies that we've conducted is that we know that there are ingredients that actually enhance the promotion of fluoride or the promotion of fluoride's uptake. And so we've put those ingredients inside the toothpaste. And so we've added lactate and we've reduced the pH. And what that does is it actually speeds up the incorporation of the calcium into the calcium ions into the tooth surface without interfering with demineralization. And so we're getting like a large uptake of the calcium fluoride ions. We've added PVMA and MA copolymers, and what they do is they actually act upon the enamel surface and they create a better surface for fluoride to attach to. And then we've also added in a co-surfactant to enhance the user experience. So when we say, what does that look like and what does that mean? We've added in a foaming agent that helps kind of spread the material all around into the interproximal surfaces, as well as enhancing the flavor. And so we like to say that we've done some tests and we've picked out a flavor that most patients are like, and we can say that it increases compliance. And so if someone's brushing, they're getting a much of the amount of the fluoride that they need. So what is the effect of the formulation and the fluoride action? Well, if you take a look at this first image on the left, you can see that our Pronamel Active Shield, the original version, and the newest version, it has an increased uptake in fluoride, right? And so against the placebo where you're not really seeing anything, but it looks like we still have a greater uptake of fluoride in the tooth surface. And when you take a look at the other end of that spectrum and you look at the solubility, when you talk about the solubility, you're talking about the demineralization, you can see that the Active Shield formulation has a higher and a lower enamel solubility reduction. And so what does that look like when you look at it on a D-SIMS again? You can see in this image on the far left that the Active Shield from Pronamel, in that orange ribbon, you can actually see the fluoride uptake. So for the first time, it's really great to take a look at that and see. And side by side, we measured that with our comparators formulas, and we can see that, their version of their toothpaste, they're not getting as much fluoride into the enamel surface, right? Versus, of course, the placebo that doesn't have any. And so in its in situ clinical study is the highest level of research that we have right now. And so when we conduct our studies and we look at acid erosion, I'm not going to tell you about what we do the whole way, but I'm going to give you a little bit of a heads up because you can look at the research if you're interested. But the patients get to wear this appliance, and this appliance has enamel specimens inserted onto it, and it has an acid attack. So they kind of introduce it to an acid attack. The patients put it in their mouth. They wear it for 4 hours. They brush their teeth. They take it out. They again, run it through an acid attack, and then they test it and they look at it and they look at it to see what is the remineralization level, what is the demineralization level, and what are the benefits of increased enamel surface. And so in this study, we took Pronamel Active Shield. We've used a placebo, of course, and then our comparator toothpaste was Crest Pro Health Sensitivity Enamel and Gum, which has the same active level of fluoride, free fluoride. However, this is a Stannis product. And so in our in situ studies, we found that our test product, when compared to our comparator, delivered more fluoride into the enamel surface. And so you can see that in this chart. As well as when you look at the results in the remineralization, you can see that our test product had significantly more enamel hardening than our comparator and the placebo. And if you look at the comparator and the placebo, you can see that they both are looking at exact the same level. So there's really no change in that they're not really getting as much remineralization as we are. But when you look at the other study and you look at the demineralization protection, you can see that there's an increase in enamel resistance to acid attack, but with the comparator, it's also high because of the stannous fluoride that was binding in the tooth. But our products still came out ahead. And so what we like to say is when we're cycling through that remineralization and demineralization process, that we get double the amount or a 2 times greater acid protection versus our mouth's natural defenses with this product. And so what does that look like? Again, looking at the Pronamel Active Shield, we like to take that pink or that red area, and we say that this product, visually, we can see that the enamel is remineralized, it's stronger, it's more acid resistant than enamel that's just treated with fluoride. And so, in summary, our formulation is developed to avoid ingredients that inhibit fluoride protection, include ingredients that facilitate fluoride protection, and improve the user experience to help with patients' compliance. And so Pronamel Active Shield strengthens and fluoridates enamel to help protect against acid erosion, and we have a comprehensive data package to support its daily use for patients who are at enamel risk. So at this time, I would like to ask anyone if they have any questions to any of our presenters that were here today. And just to retouch on that, I'd like to, if you have any questions for Bernice and what she sees clinically, or if you have any questions for Anderson on the development of assessment tools, we'll take another couple of seconds to give you guys an opportunity to speak. In the meantime, if you want to learn more information, please scan the QR code that's in front of you, and you'll be able to link to our site where we have a lot of resources for patient education as well as for disease condition.